a new team of experts is now tasked to study the new COVID-19 variants with health spokesperson Rosario Vergeire at the helm. Let's speak now to one of the members of the group, infectious disease specialist Dr. Edsel Salvaña. He joins us now on the line. Dr. Edsel, thank you so much for joining us. You're currently in the midst of another meeting as we speak to you on the final word. Tell us, Doctor, for the peace of mind of our kababayans, what is the final verdict? Is this UK or South African variant in the Philippines or not?
Well, at this point, we have not detected the South African or the UK variant. That doesn't mean it's not here. It's just that for the samples that we've looked at, there is no evidence that it's here yet. But I think the prudent thing to do is to double down on our healthcare measures such that if it's here or if it ever gets here, then at least we're ready.
But in your view, you think, Dr. Edsel, the government imposed a travel ban on time that could have stopped the entry of this variant into the country? Or could it already be here, but it hasn't yet been detected?
Well, we haven't had any big spikes, although we are expecting one after all that holiday celebration where there were a lot more parties. But, the thing about it is this was already circulating in the UK in October and November, and they only detected it in December. And they only linked it to a possible increase in transmission December. So I think that what happened was once they had some data that was suggestive that it was more infectious, then they disseminated this, and the countries acted accordingly, including ours.
So break down these new variants for us, Dr. Edsel. How different is the UK and South African variant from the current COVID-19 that we have in the country? And why is it more infectious?
Well, originally, when we got back in January, if you remember, we had 3 cases that were brought in by 3 Chinese tourists. That was a different lineage, lineage A, and also lineage B. And between January and March, we didn't have any transmissions. But when we started to see the new ones in March, they were actually not related to those first 3 Chinese tourists. So it actually came in via a different country, maybe Japan and other places like South Korea. Actually had more introductions after that. But they were more or less from, they didn't have the variant mutations that caused increased transmission. Then sometime in June, we got the D614G mutation, which originated in Europe. And that's 3 to 9 times more infectious, and that's when we saw that surge June, July, August, and we had that 2-week period where we had to briefly revert to MECQ. We were able to control that eventually, although, it was a near miss. And so now, our cases are hovering at about 1,000, 1,500. We haven't seen the post-holiday surge yet, although we are expecting it in the next couple of weeks.
Yes.
And I think the most prudent thing really is, even if it's here, you don't want more variants to come in.
Yes.
And so the bottom line is that if our cases stay steady, then as long as we do a good job with our minimum health standards, we'll be okay.
But effective tomorrow, there will already be 27 countries, in the travel restrictions list. Do you think, Doctor, that we should just basically close our borders so this variant will not enter the country?
Well, again, we still don't have evidence that we haven't detected the variant here yet. But at this point, it's a fluid situation because part of the problem is that even the other countries that are reporting it, there are other countries that may not be looking. So, it's very difficult to decide. What we're really trying to do is to be extra cautious so that even if there's one variant, baka hindi yun mag-spread para hindi na pumasok ng iba pang variants. It buys us time. But remember, that's not sustainable. You can't completely close yourself out to the rest of the world. But in the meantime, we really have to beef up our defenses, fine-tune our policies, and really, we just need to stick to the quarantine and the testing that we're doing right now. And whether we need to add more travel restrictions, those will be decided as data comes in. But once a country has at least one variant, a reported variant, then that's the time, once WHO has confirmed that
Yes.
we actually take action based on our current parameters.
But to also beef up our defenses, not only in our borders and minimum health protocols, is also to beef up our personal health defenses, and that is to be vaccinated. We will have maybe these vaccinations within the end of the first quarter or by early second quarter. But are Filipinos, in your view, Doctor, ready to be vaccinated, ready to be inoculated?
Well, I hope so. I mean, we have a lot of work to do, after the Infectious fiasco. Vaccine confidence really did take a hit. And now in the United States, we're hearing that about 40% of people, including healthcare workers, are refusing the vaccinations. And that's very disheartening because, these vaccines are being made with the thought that the benefit will greatly surpass any potential problems with the vaccines. They are safe and effective. But we have to hammer home that mindset because getting vaccinated is not just for you, but, if we get enough people vaccinated, then maybe we'll get to herd immunity and we'll protect everyone.
And some surveys you mentioned have shown that there isn't that much confidence in vaccinations, but Metro Manila mayors are also finding out that many of their constituents prefer the Western vaccines compared to the Chinese vaccines. Why do you think we have that kind of mentality or that kind of mindset?
Yeah, I mean, I think that there might be some issues with communication regarding the data and what data is available. I think that the important thing is that we educate people and also, educate them on the processes that are involved and how we can scientifically say that it is safe and effective. And there is a global standard for this. And so we have to hold all the vaccines, wherever they came from, to a global standard. So we have confidence that whoever made the vaccine, whether it's Chinese, Russian, European, or American, sticks to the same standard. And so we have confidence that it works and it's safe.
Infectious disease expert Dr. Edsel Salvaña, thank you so much for your insights.